My name is Dr. Sabah Eric. I have passed my MCPS Ophthalmology exam on 8 January 2022 and I did my MCPS training from Sindh Institute of Ophthalmology and Visual Sciences, SIOBS, Hyderabad. I would like to share a few guidelines and tips as per my experience for those candidates who are preparing for MCPS exam. The MCPS exam consists of various components. The first one is theory, TOEFS, and then clinical exam. To be eligible to go to TOEFS and clinical exam, you have to clear the theory first. The time duration that is required for the preparation of theory of MCPS exam depends on your schedule and your availability and whatever time you have to study. For me, it took around 6 months to prepare for the theory examination because I am a working mother and I have so many other responsibilities. That is why I took some time to prepare for the MCQs. But it can be done in a shorter time if you don't have so much responsibilities and you don't have a very busy schedule. The MCPS theory exam consists of 2 papers, paper 1 and paper 2. Paper 1 is involving mostly the basic MCQs and also covers a few of optics and refraction MCQs. Paper 2 is mostly clinical and scenario based paper. The books required for theory preparation is basic book is Kansky. You have to read Kansky thoroughly. Especially the main topics of Kansky, every line should be read very carefully. For me, I felt that it is very easier for me to keep an MCQ book along with Kansky because we read the topics but we don't know how to solve the MCQs until and unless we practice MCQs. So basically, the theory paper is requiring you to practice as much MCQs as much as you can. Kenneth Wright is a good book. American Academy MCQs are very good. So you should be practicing MCQs. Also, please consult the past papers as well. And there is a book called there is a series called Provision Files. So they are very useful in practicing the MCQs. For me, it was easier to consult an MCQ book along with reading Kansky. Because we are reading the topics thoroughly, but we don't know when it comes to solving the MCQs. So the basic trick and tip is to keep practicing the MCQs as much as you can, because in the theory paper when you get the MCQs and scenarios, you are already prepared on how to solve those MCQs. So Kenneth Wright is a good book. American Academy MCQs are very good. Provision File series are very good. So you should go through all these thoroughly along with reading the Kansky. You should also go through the past papers to solve the MCQs, especially the optics and refraction MCQs and the basic MCQs. Now we come to the TOEFS session. When you pass the theory, you have to score 75% in each exam, and when you are scoring above that or 75%, then you are termed as clear in theory exam. Then you go for TOEFS examination. For TOEFS examination, the structure is that there are 15 stations, out of which 5 to 6 stations are of optics. So you should be very, your reflexes should be very swift while performing the retinoscopy, the squint assessment tests, the Jackson's cross cylinder. You should be very much aware of transposition, that how are you going to transpose a given spectacle number, and you should be very prompt in doing all the optics and refraction related assessment and examinations. The other stations are mainly consisting of clinical scenarios. You can be asked about anterior segment, posterior segment. You can be asked about an OCT or a CT scan, a perimetry, or you can be asked about the surgical techniques. The clinical examination consists of 1 long case and 4 short cases. For the long case, you have 30 minutes to examine the patient and 30 minutes is for viva. So this is the main component, and this is the most important component of your clinical examination. In the long case, you have to be very vigilant. Your reflexes should be very swift. For the long case, your history taking should be very nice. You have to practice again and again. Your history taking skills should be very good, because they would be leading you towards the proper diagnosis of the disease. And then you have to be very prompt and very swift while performing the visual acuity and extraocular movements and color vision and all other examinations, eye examinations. So you have to divide your time accordingly, like 5 to 8 minutes you have to give it to history, and then accordingly you have to complete the examination in about 20 minutes, because the last 10 to 5 minutes you should have to compile everything when you have to present your case to the examiner. And after that, the examiner is going to ask about all that you have seen, and then the viva is up to the examiner. Then the short cases, there are only 10 minutes for the short cases, so you have to be very prompt and very swift and just listen to the command of the examiner. The commands are examine the anterior segment, examine the external reading exam, examine the posterior segment. So you have to be very careful about the command, and so that you don't look puzzled to the examiner. Basically, you have to divide your time. The diseases are the same. It's not a difficult exam to pass. So you just have to be confident while doing the examination and while performing the clinical assessment over the patient, and you should be very clear in your mind about the management plan of the patient, because management plan is very important, especially when the examiner is asking you about the clinical patient. For the books that you need is again, Gansky is a very basic and recommended book. Then you should go through the Oxford Handbook of Ophthalmology. Monk is a very good book for viva preparation. Also, there are notes that are there is a book of notes that is called Major Tanner's Notes, where I found it really very nice and very helpful guide to prepare the according to the examiner's thought. Chua book for FRCS preparation, that is for clinical assessment, it is also very good, and so you have to look through all these books. Also Professor Hagan's book and Dr. Sain's book is very useful for the viva preparation, especially when you have a little and limited time left. So I wish you best of luck, and please always be confident, believe in yourself, that it is not a difficult exam at all. Just hard work and advice from your seniors, help guidance from your seniors is very important in passing any exam. Thank you so much.
I know you told your friend you're not okay, and tell me what's wrong and why you never said you felt that way. And guess you're trying to stay strong and